Hi, everyone. My name is Jeffrey Callahan. I'm an MPH candidate in Family and Community Health at Purdue University, and today I'll be presenting my project entitled Prisma Health Emergency Management Preparedness. To give you a little bit of a background on my community partner for this project, Prisma Health is a 501c3 nonprofit health organization that was founded in 2017. It's one of the largest employers in the state of South Carolina, and it covers about 51% of the patient population in the state. The mission of Prisma Health is to inspire health, serve with compassion, and be the difference. Within Prisma Health, there are several different departments, and for this project, I chose to partner with the Emergency Management Department, whose responsibility it is to oversee the entire organization's disaster response efforts during the event of a disaster and in preparation for one. When I started this project, I sat down with the director of this department, Dr. Jordan Bradway, and discussed the biggest needs for the emergency management department. And he said that the two biggest needs at this time were the purchase of two different pieces of equipment, one being a mobile incident command center, and the next being additional medical field cots. The mobile incident command center would allow hospital staff who are involved in the delegation of responsibilities to other staff members to conduct this responsibility as well as their on site responsibilities within the hospital during disaster response scenarios. The additional medical field cots would allow there to be an increase of 25 patients being treated during a disaster event at the onset of the disaster. The outcomes for this project that I created are listed in the outcomes section, both of which being to reduce mortality by 5% in the event of a disaster, but their short term and midterm outcomes being different to get to that. And that would be obvious given that they are such different pieces of equipment. To receive this funding, Dr. Jordan Bradway explained that the best way to do this would be to write a grant proposal to the South Carolina Department of Health and Environmental Control, or SCDHEC. The budget for this entire project in funding of the two mobile incident command centers and 25 medical cots is broken down by line item in the budget section of this poster. And the timeline for this project, which would all be within 1 year, is broken down into quarters in the timeline section of the poster. To evaluate the effectiveness of this grant proposal getting funding, that is broken down in the evaluation section of this poster, with the ultimate evaluation being whether or not the 10% reduction in mortality due to the funding of these two new equipment pieces would be achieved. So I would like to take this time to also acknowledge Prisma Health, the Emergency Management Department, the Emergency Medical Services Department, Jason Kirk, and Dr. Jordan Bradway for their assistance throughout the duration of this project. My references are listed in the references section of this poster, and if there are any questions about anything that I've discussed today, feel free to reach out, and I wanted to thank you for your time.